The next session was on preventing obesity-related disease and brain decline. And the first intervention, it's up to you, isn't it? Oh, no. Okay. The first speaker spoke about the consensus that fruit and vegetables are good, especially good for health, especially when they are associated with lifestyle changes, and maybe not on their own. Otherwise, there is sometimes inconclusive evidence on the benefits related to fruit and vegetable consumption. Some studies report a possible gender difference on these benefits. It's important to raise the awareness and the training of GPs on the interest of fruit and vegetable consumption and the communication on it with their patients. And in Portugal, there was a 3-year program on this issue. There is possibly different mechanisms that may support the benefits associated with fruit and vegetable consumption. One is the decrease in global energy intake associated with a higher consumption of fruit and vegetables. And another mechanism can be the increase of fiber and polyphenol associated with these nutriments, and also the decrease in the glycemic index. And the speaker made several recommendations. Some of them are well accepted, especially to eat at least 3 vegetables and 2 fruits a day, as much as possible of various colors, and also to have a diet including whole grain and legumes, and to do not confuse between the interest of fruits and the less interest associated with fruit juice, as fruit juice is a sweet drink.
The next presentation came from Finland and talked of decreased diabetes risk over 13 years by improving diet and exercise. We have to remember that diabetes is associated with multiple cardiovascular disease risk factors, and that therefore we need multiple and different interventions. But there is now good and substantial evidence that weight loss and a better diet and exercise will reduce the risk of diabetes. In fact, in the UK, there has been a recent paper this year which built on evidence from a previous hospital-based intervention system in Newcastle and Glasgow, but brought it out into GP practices and got multi-professional teams to reduce the carbohydrate intake of people with diabetes. They reduced it substantially. That is sort of 600 calories a day for 8 months, and then a maintenance diet after that. But nearly 50%, 49.6% of the patients reversed their diabetes. That is, they achieved normal hemoglobin A1Cs.
Then our colleague, Dr. Assayag, which is cardiologist in France, reported on a survey including 200 French cardiologists, and he observed that nutrition is considered as a low priority issue by many cardiologists in France, and one reason for that is that diet is not so much taught in medical schools, And the French cardiologist reported that usually they only gave advice to the patient if the patient asked them to do that. And sometimes they also referred the patient to nutrition specialists.
And the last and most interesting presentation maybe was about whether diet can prevent Alzheimer's. And we wanted to know if people who had listened to the lecture did remember what they'd said. This is this is pioneering. It's a large random controlled trial, and it is addressing multi-domain lifestyle interventions. So it's not just diet, but it's exercise and cognitive training, as well as other lifestyle changes. And although this hasn't been published yet, as Dr. Ngango told us, there may well be evidence that changing your diet does improve your cognitive function. This might be mediated by a reduction in cardiovascular risk factors, because we know that about 30% of elderly patients who have Alzheimer's also have vascular dementia. But to get more evidence, there is now a worldwide FINGER trial. FINGER was the original Finnish trial, but they now are involving centres in 5 different continents. So there is every chance that we will get good evidence that taking care of yourself improves your brain.